If you're chronically ill, you probably know what I'm talking about. That first time where somebody fell off the pedestal, fell from grace, and you were like, man, I don't have trust 100% in the medical world. And then you probably realized you needed to have discernment in how you interacted with the medical world in the things that you were saying yes to. Hello and welcome back to another week of Calling in Sick. I'm your host, Alex Wildeson. Y'all, thank you from the bottom of my heart. We hit 5,000 subscribers on YouTube, which feels like a moment that I need to celebrate. We're not even a year into this whole journey, and here we are with 5,000 people tuning in every single week on just YouTube alone to talk about calling in sick, to listen to guest stories, to listen to community stories, and to dive into some topics that we all deal with. And from the DMs and the comments I get from you guys, I think we're all learning together and from each other, and I think that's the most beautiful thing in the world. So thank you from the bottom of my heart for being a part of this. I love you guys immensely. My next goal is 10,000 subscribers on YouTube. You guys know me. I never settle. Keep on going. So please send this podcast to a friend, to a family member, a classmate, a teacher, a coworker, a doctor. The more audience this reaches, hopefully, the more educated people get about chronic illness and what our lives look like dealing with chronic illness. And then on the other side of that coin, if you have a chronic illness, I'm hoping and praying and sending all the vibes that you feel seen and heard every single week, and that it feels like you're hanging out with a friend on the couch, because that's certainly how I feel with you guys. So, thank you. Speaking of all of us feeling seen and heard, over the weekend I was scrolling on my feed and somehow got onto the feed of medical providers shit-talking patients. Y'all know I'm on a Prednisone burst right now. Oh, my blood pressure went through the roof. My blood was fucking boiling. I'm sure steam was coming out of my ears. I was so pissed. I can't believe that there are people out there that feel comfortable going online and shit-talking essentially their customers. Very strange behavior. I cannot imagine a business person doing that in their right mind, because that would end their business. But for some reason, some medical providers or people in the medical field feel comfortable making these patient hate videos, and it is gross. The one in particular that I'm referencing right now was an ER bed, some viral sound, and the text overlay said something around the lines of, when a patient says they're at a 10 out of 10 pain, but they're scrolling on their phone. If you go and click into that post, your girl might have let some of her rage out. I responded to a lot of comments, and I said, that is just absolute and utter bullshit. Because when I'm at a 10 out of 10 pain, I know if I scream cry in the ER, I'm not going to get medical attention, and I'm going to get shit talked by medical providers potentially, saying she's being dramatic, she's being needy, she's being over the top, exaggerating, and I'm not going to get help. I've learned that if you're in the ER, you can cry, but it needs to be quiet enough. You can be upset, but it needs to be within limits. And in order to do that, I usually have to distract myself. I scroll on my phone when I'm at a 10 out of 10 pain, because if I just lay there, then all I'm doing is thinking about the pain. So seeing that post, I was like, dear God, these are actual people working in an ER setting that think this, that if you are on your phone while you're waiting, you're not actually in that level of pain. Still blows my mind to this day that people think reported pain is arguable. Like, no, it's not. If someone says they're in pain, they're in fucking pain, and that should just be believed and helped instead of questioned. Which brings me to this week's topic. When you should feel comfortable to say no or not right now to medical providers, procedures, and medications. Big disclaimer at the top. I am not a doctor, and I am most certainly not telling you to stop taking your medication. Instead, what I'm telling you is when you're going through your diagnostic process or just your chronic illness journey, and you have decisions to make, you should feel empowered to say no just as much as you feel empowered to say yes. So I'm going to run through those three different buckets: providers, procedures, and medications, to kind of highlight the areas that I think can be worthy of a no, or at least a conversation. So we'll dive into that. But before we dive into the nuts and bolts of this week's topic, I've got Alex's picks. And very, my new favorite word, apropos My picks of the week are pants, because sometimes you got to put on your big girl pants and grit through life, or find the autonomy and free will that we have to say fuck no, or fuck, comma, not right now. So my picks of the week are jeans. And I picked jeans, not sweatpants like I usually do, because when I go and I see a new doctor, or a doctor that I know requires a certain level of presentation, I swap out my sweatpants or my leggings and I put on good old-fashioned jeans. But I am hypersensitive. My skin does not like tags. My skin gets itchy, it gets uncomfortable like that. I've got dysautonomia, small fiber neuropathy, and CRPS, so I have to dress accordingly. But I have found 2 different brands of jeans that are like butter. First one, Abercrombie. Abercrombie is just making the comeback of all comebacks, and I'm so freaking excited because back in the day, my sweet parents did not let me shop at Abercrombie because it was very salacious in their marketing and making high schoolers look like sex objects. So my parents didn't want to support that, which looking back, I'm like, go you, fuck yeah, take that political stance. But nowadays, I think their marketing's changed a little bit, and either way, I'm shopping there. I freaking love their jeans. I size way the fuck up so that they can be extra baggy and extra comfy, and I love them. Link in the description below. I'm working on a discount code. If you want to splurge, I have 2 different options for you. The first one is kind of ridiculous because they're really expensive, but you can find them on Poshmark or The Real or Depot or whatever. Rag & Bone has sweatpants jeans, and I'm not talking like jean leggings, jeggings from 2008 that did not really look like leggings. They didn't really look like jeans. They look like leggings, let's be honest. These sweatpants jeans look like jeans. I've tried them on. They're amazing. Have I spent the money? No, because they're $200 fucking dollars. But one day I probably will, because I've been thinking about them quite truly since February when I first tried them on. The second pair of jeans I would also suggest shopping on The Real or Poshmark is Mother brand. So soft. Mother also makes a cheaper version of their jeans that have the same buttery texture called Snack, and that I believe is sold at Nordstrom and Nordstrom Rack. Anyway, denim for when we need to dress up a little bit, not wear any makeup, and show up looking slightly put together but still sick enough to deserve care for those doctor's appointments. And when I say those doctor's appointments, I'm talking about the ones we're going to discuss today. The ones where you need to find that will inside of you and the courage to say no or not right now to them or to their recommendations. So huge ass disclaimer I'm putting at the top of this episode. This episode is all about finding your agency and free will to feel comfortable saying no in the appropriate setting with medical providers to discuss procedures, medications, or just deciding on the doctor themselves. What I do not want anybody to walk away thinking is that I'm telling you guys to say no to everything your doctor is telling you to do, to not take your medications, and to not schedule your procedures. Everything is taken with a grain of salt. And also, whenever we do an episode deep dive like this, it's for super specific topics. So tune in to hear when I think it's appropriate to say no or not right now. And don't just take that as broad paintbrushing that you can say no and should say no to everything. And I feel like after 25 years of living with chronic illness and learning the lesson the hard way more often than not, I feel prepared and okay giving my opinions and advice and experience on how to say no and have a better outcome than maybe what I experienced in the past. So let's get into it. It is, first things first, it's hard to say no. It's hard to say no in every arena of our life if you are a people-pleasing person like myself. And I found a lot of chronic illness patients are people pleasers. Why is that so coded to chronic illness? I don't know. It's probably stress. Let's be honest. Indicative of one another. But specifically in medical situations and scenarios, it is really hard to say no. And I was sitting down prepping for this episode trying to think through why, what causes that. And the first thing that jumped into my mind was, as a healthy person, we have this magical thinking that all doctors and all of medicine is black and white, that it is just science, no art, answers to everything, and that anybody that works in the medical field knows exactly what they're doing, that they're the best person ever at their job, and we should just say yes because of course they know better. But once you become a little gray-haired in the medical space as a patient, you start to realize that that is not true 100% of the time. Of course, there's amazing fucking doctors out there. All of us can probably point to at least one medical provider in our lives that has helped us significantly. And I'm sure we can also count on more than our hands the amount of times we've had negative interactions in the medical space and wish that we had that agency or free will or confidence to say no or not right now in those situations. So I guess what I'm trying to say is, when we go from healthy to sick, our idealism that we have around the medical world and people that work in the medical world starts to crumble over time. Now, if you grew up in a family that also worked in medicine, coming from personal experience, that tumble is even harder. And I remember the very first time I had a bad medical experience, and I was distraught, not just because the experience was bad, but because this idea that I had built up in my head that not every doctor is going to be like my dad, who is an amazing doctor. And it was ideology shifting, I would say, which sounds dramatic, but it's not. If you're chronically ill, you probably know what I'm talking about. That first time where somebody fell off the pedestal, fell from grace, and you were like, man, I don't have trust 100% in the medical world. And then you probably realized you needed to have discernment in how you interacted with the medical world and the things that you were saying yes to. Because after all, it's your body and your life, and our guts are usually pretty decent at giving us direction if something is going to be good or not. And so if I'm looking back, I think there's 3 areas specifically where it's really important to learn how to say no or not right now. And that's providers, procedures and testing, and medicines. We'll start with providers because that one feels like the easiest, and we've talked about it a few times. So you might need to say no or not right now to a provider if it's not a good match, if they're not educated, or if they're not collaborating with your entire team. So I get DMs all the time asking, Alex, how the hell are you supposed to know if a provider is a good match for you? And while I don't have the perfect answer because I'm just a girl named Alex, here's what I think. If a provider makes you feel stupid, and I'm not talking about like they have an ego and this godly presence and perhaps they're a little condescending. No, because sometimes those people are a little bit hyper intellectual, if you will, and they're the best doctors in the world, but they have shit bedside manner. What I'm talking about is they're mean to you. They make you feel like any question you ask is inappropriate, is uneducated, is, to lack of better words, is dumb. Those providers are not going to be the ones that are going to help you when you're in a sticky situation. You want a doctor, ego or no ego, to at least hear your question out and give you an answer instead of saying, that's stupid and moving on. And so if it's not a good match from that direction, you might want to say no, find a second opinion, or just move the hell on because you're going to spend time with these doctors one way or another. You might as well at least feel comfortable getting care from them. You might also want to say no to a provider if they're not educated in your illness. Now, this is probably more relevant if you're newer to the chronic illness space. One thing that continuously blows my healthy friends' brains is when I have to explain to them that a PCP, an ER doctor, an urgent care doctor is not going to help you with your chronic illness. Sure, they might do a quick Band-Aid here and there, but that person is not going to have the answers. They're not going to be able to diagnose you, and they're sure as hell not the right person to manage your chronic illness. All of those kind of providers know a mile wide of information, but only an inch deep. So sure, they might be able to see this puzzle and go, well, you need to be seen by a rheumatologist or a cardiologist or a nephrologist. I'm listing a bunch of ists right now because those are specialists. A specialist knows a mile deep of information, but only an inch wide. They know everything there is to know about their one very specific field. And that's why you can't go to your rheumatologist and ask questions about your heart. They're not trained in that. They're not going to be the right provider to help you with that. And that can be so frustrating when you're a patient and you keep hopping around from perhaps an ER trip, then an urgent care trip, then finally you get into a primary care physician and you're on some big ass wait list to go see a rheumatologist. It's frustrating, I understand. But keep reminding yourself, if there was something severely going wrong, if you were having organs failing, that would show up in preliminary scans and testing and blood work. In which case, you probably could get into that specialist quite a bit faster. So I guess under the not educated umbrella, that's not just a no to that provider, but it's a no for us to remember. That not every medical provider is trained enough to help us with our very specific complex chronic illnesses. And then my last area, and the last area that I think we need to remember to say no or not right now, is if a provider is unwilling to collaborate with any of your other providers. Chronic illnesses are notoriously complex and cover so many different areas of our bodies. Well, unfortunately or fortunately, however the cookie crumbles, Western medicine is so specialized. So if you have something going on in your heart, in your kidney, in your gastric, and in your brain, that's probably 4 or 5 different specialists right there that are going to be helping you. They don't always play nice in the sandbox. So you need somebody to play quarterback and make sure that all of these different people are touching base, at least sharing notes, perhaps talking, and making sure that you're getting the best care possible and that whatever those other specialists are doing are supportive and complementary to one another and not detrimental to your overall health. Now, a super common misconception in the chronic illness space is that your primary concern, for me, that's rheumatology, that doctor should be your quarterback. And in a perfect world, that would be the case. But that's not always the case. For a while, my quarterback was my dermatologist because she's the one that caught my vasculitis, diagnosed it, and helped me start treating it while I was still looking for a rheumatologist. So if your quarterback for your team doesn't totally make sense, as long as they're helping you and coaching and talking to everybody else, you're set. Don't rock the boat. If it's not broken, you don't have to fix it. Speaking of all of your specialists playing nice in the sandbox together and making sure they have complementary procedures and medications that they're putting you on, that leads me to my next area of your medical journey, that you need to be prepared and feel comfortable saying no or not right now. Now, this might rock the boat, but stay with me. When I first got sick, I was having symptoms that would send any regular-ass healthy person straight to the emergency room. My heart rate would randomly skyrocket into the 200s. I was shitting blood sometimes. I had debilitating pain that I would pass out or have seizures from. Any of those things alone is cause for emergency. But when you become chronically ill, you start to realize that however horrific each of those things are to go through, they're not necessarily always a sign that you need to change something ASAP. I'm not saying don't go to the ER or don't tell your doctors when those things are happening, because 100% you should be talking to your doctors and they should be making a decision with you on what you should be doing in those situations. But for me personally, I've learned that sometimes my body just does funky things, and if I wait it out and don't rock the boat, I'm okay. And so if we're in that mentality, then we can start to understand that our schedules are our own. So doing certain procedures or testing does not actually always need to be done immediately. A very easy layup example of this is scheduling infusions. In the past, I've been known to schedule IVIG right when it's due because my body will pay for it if I don't. But as I've gotten used to the medication and started to realize really where those boundaries are for how long I can stretch it, I've come to the understanding that I don't need to have it down to a day. If I'm a few days late, it's okay. So, for example, this year, my IVIG schedule was going to land on my birthday. I've had so many birthdays where I felt like shit. I've been in the hospital in an infusion chair. This year I said, fuck no, or not right now. So I scheduled my IVIG around, did it a little bit earlier. I did it a little bit earlier so that I could feel decent-ish on my birthday. And that's what I'm saying, is like you can find the autonomy and free will to schedule your appointments or procedures when it works for you and your schedule. Of course, within reason and with, doctor approval and sign off. Now, of course, there's other things like testing procedures. I'm talking MRIs, CAT scans, gastro studies like endoscopies or colonoscopies that might need to get done on a tighter timeline. Like if I were to email my provider and say, hey, just a heads up, I'm having some gastric flares again and shitting blood, my provider might want me to get in rather quickly to see my gastroenterologist. Now, scheduling that endoscopy or colonoscopy might determine how long those symptoms have been going on, what color that blood is, not to get too graphic. But when I've had this happen, I've had gastroenterologists tell me, look, I think it was episodic. It only lasted 3 days. This is not indicative of internal bleeding. We can do the endoscopy and colonoscopy in a couple weeks, so just find a time that works in your schedule. That's always given me peace of mind. But I think probably the most common thing that we all run into is when perhaps we're working with a new provider and they tell us, I'm going to need you to flare for us to run some tests. That happened to me when I went to UPenn for my clinical study. If you haven't listened to that episode, it was in late April, early May, and you can hear all the tea on what it's like to go travel by yourself for a clinical study. But back to the story. I saw a rheumatologist there, and his assumption was that some of my symptoms that I have could be from IBD. And so he wanted me, so after reviewing all the testing I had done, he noticed I had never had a capsule endoscopy, which kind of sees how things move in my esophagus and upper gastric area, ? See, this is how you can tell I'm not a doctor. He said I needed to flare, get off prednisone ASAP to do this test. Getting off prednisone ASAP when you've been on it for a year sounds like a particularly deep cut of fresh hell that I would like to avoid if possible. So when I got back home to Austin, I talked to my providers and they said, Alex, this is not an ASAP thing. If you had something going on, like if you were losing 15 pounds a month, that would be an ASAP thing. This is discovery, curiosity. This is not an urgent response to current symptoms that are unmanaged or are drastically unmanaged. So we are doing a slow taper off of my prednisone. I'm finally at 10 milligrams. I was on 45 or 50 at the time of this clinical study. And when I finally get off prednisone in early fall, I will then be scheduling my capsule endoscopy. But I'm not going to do it fast because I don't need to. So fuck no right now, I guess I should say. And speaking of testing, if you've already done a certain test enough times, you probably don't need to do it again. I have had upwards of 10 biopsies for my very specific form of vasculitis. Now, if it were to travel into an internal organ, of course I would be okay with my doctors taking a biopsy. If they want to see more skin biopsy proof points, I'm not in it. I'm not going to be doing that. I've had enough. They all show the same thing, and we know what it is. So I don't feel like I need to do more of those tests unless it was necessary for insurance for some approval of medication, which I don't think it should be, but I guess that's my caveat. And speaking of insurance, that's the other time where I think you should feel very comfortable and confident saying, fuck no, or not right now. If you are at the end of a insurance year or at the beginning, you're cognizant of costs. If it's something like if it's a test or a procedure that can be pushed a little bit, do when the timing is right for your cash flow and your insurance, deductible, copay, all of that jazz to make it work for you, your life, and your pocketbook. But one thing that you should probably toss away and completely ignore regarding insurance coverage and cash flow, honestly, is your medications. If you are on a medication that you and your doctor have agreed to, it's important that you stay on it and stay with it until you guys have a conversation that says otherwise. Coming off and on medications quickly in the chronic illness umbrella or mental health umbrella can have a lot of very severe side effects that are avoidable if you do things safely and slowly. I'm talking about prednisone like we discussed in last week's episode. You can avoid withdrawal symptoms if you go low and slow on that taper plan to get off of the medication. Going cold turkey doesn't help anybody. But you don't have to automatically say yes to every medication that your doctors propose to you either. And there's 3 areas where I think it's appropriate to say no or not right now. The first one is if you are fucking shit terrified of the black box warnings. That means you need to have a conversation with your provider to get comfortable. Because if you're at that point and you require a medication that's that aggressive, you're probably going to have to get comfortable with one of them. So having super candid conversations with your doctor to figure out when the timing of those medications might be best for you is totally appropriate. The second time you want to say no or not right now to a medication is if you've waited the appropriate time period for that medication to get to a therapeutic level. If you have an autoimmune disease, you have probably heard this. It takes anywhere from 2 months to 6 months for most immunotherapies and chemotherapies in the chronic illness space to get to a therapeutic level. And a therapeutic level means the medication is at its correct dosing, your body is now absorbing it and working with it in the right way, and you should be seeing an impact to your disease presentation, meaning you should be feeling better. Not having flare-ups, your symptoms should be improved. They might not go away ever. Chronic illness kind of means forever, but you should see an improvement or start to see an improvement. If you have no change, or you're getting worse, or you've been unable to get off of prednisone to let this medicine do its thing, or if you've been on prednisone and you can't taper without flaring, and I'm not saying withdrawal symptoms because flaring and withdrawal symptoms can sometimes feel and look similar, but if you can't get off prednisone or you get off prednisone and you feel fucking awful for weeks on end, it's probably time for a conversation to look at other options. Thankfully, it's 2025. There are options. I remember in early 90s when I was first diagnosed, there were not a bazillion options to manage chronic illnesses like autoimmune diseases. You just had what you had and you took it, and if it worked, great, and if it didn't, you were kind of shit out of luck. But nowadays, there's options. Thank you, medical research. We love that, and that's what continues to give me hope. If I do burn out of every medication out there, being a refractory patient, meaning I don't respond forever to all the medications, I bounce around quite a bit. There's always new things on the horizon. And the last time you want to say no, not right now, depends on your life and lifestyle. We'll get into the nuts and bolts of that in a second, though. Let's go back up to the first one, being scared of side effects. Super reasonable and super, super normal. If you've been having a duvet day and you're watching TV and you've seen a pharmaceutical ad go onto your television, the last 20 seconds of it probably are black box warnings spoken at breakneck speed. But if you listen closely enough, they say some pretty scary shit like cancer or PML or whatever. Things that should make you scared. That also should be taken with a grain of salt, though. Think about why a pharmaceutical company might want to list everything out there, including death. Liability. It always comes down to liability for corporations. They protect the business's interests by putting everything out there possible so they cannot get sued for failing to list a potential side effect. That does not mean the side effects that they list are all that common, all that likely, or even seen that often. I guess it's kind of a repeat of what I just said. But they still have to put it out there, otherwise they're at risk of getting sued and, losing millions of dollars. Wrongful death. That said, it's still reasonable to hold some kind of anxiety around some of those side effects, especially ones like cancer. I think probably death, PML, those things, far less likely. Developing a secondary condition down the road because of your autoimmune diseases and the management and medications that you're taking, that unfortunately is a possibility. And those are conversations you have to have candidly and bluntly with your provider to pick out and figure out which medications you feel comfortable on. But everything in medicine is a risk and a reward. If you want to feel better and you are pursuing Western medicine, there's only so much that you can do or take. You can, of course, try the functional route, the lifestyle routes to figure out what works for you. But the North Star and goal for Western medicine, and candidly all the other modalities too, is to be on the least severe or life-impacting medication that can give you the best outcome. So the way I like to think about it is that there's tiers of medications. We've got the lowest tier like NSAIDs or sulfasalazine, that was used back in the day for myself, and indomethacin, which is an NSAID. And then we have the most severe, like Cytoxan chemotherapy, which is used for really, really aggressive, hard to control autoimmune diseases and also some cancers. And then there's a ton of shit in between that sandwich. So your doctors, so when you first go and see a new provider, hopefully they're starting you at a reasonable place so you have places to go upwards if you need more control, but that you're not screwing and fucking over your body by starting at a too aggressive medication, if that makes sense. Now, of course, that's easier said than done. I remember when I first went to pain management, took my first pain medicine in my entire life, and I took it at the same time as my anxiety medication. And I felt kind of weird. Well, of course I felt weird as taking a pain medication for the first time in my life. What did I do though? I Googled. And what did Google tell me? That I was having serotonin syndrome and needed to go to the emergency room immediately. Was that correct? Fuck no, it was not correct. Did it make me fear serotonin syndrome for the rest of my damn life? Yes. But now it's also kind of comical and laughable because that's not super common. You can monitor your serotonin levels. You can also work with your providers on timing your medications correctly so that you are protected from something like that. And this is why you always want a quarterback on your medical team that's making sure all of your medicines are okay, not interacting with each other, and that you're taking them at the right time and dosage for your body and for your other medications. So if you're listening to this and you're going, yes, I have anxiety about some of these side effects, you're definitely not alone. But don't let anxiety and fear dictate stealing away a better quality of life, because that could be out there for you. Now, all that said and done, I know specifically that there's going to be a time in my life where I'm going to say no point blank to a medication out of fear, but not fear out of side effects. When Cooper and I are going to start a family, I want to be off of these aggressive medications before we even try to conceive with our IVF embryos. I want this to be a non-toxic space. Our plan is and has been for the last 1.5 years that I'm on this 2-year aggressive treatment plan. Then we're going to take 6 months to a year to detox my body, do functional support, get my body healthy, healed, and ready to go. And then we will implant. And during that detox period and the implantation period, I'm going to be saying no to some medications, all within reason of fucking course, and I'm going to be working closely with my doctors. They know that this is my goal. They know that this is my dream desire. And I also know I have to be flexible, I have to be understanding, and most importantly, I have to respect my body. I have to honor it, and I have to love it. And if my body can't do what my wish is, then that's okay. And I'm not going to be hard on this little body because it's doing so good at keeping me alive. And it has done so good at keeping me alive for all of this time. But all that said, I don't want to be on Rituxan or Prednisone or pain medication when I'm trying to get pregnant. I want to be on as limited and low amount of medications as humanly possible. And that's just a personal decision and choice. And that also might change in the future. So don't hold me to it if I change my mind. And speaking of pregnancies, I think that leads into my last point of this whole spiel. And that is, sometimes you do make medication decisions based off of the life or lifestyle that you want, like getting pregnant. One of the most hilarious times that I did this, and boy, do I fucking regret it, was when I graduated from college and started my first job in investment banking. At the end of college, I was getting Remicade infusions every 4 to 6 weeks. It was pretty aggressive. I had to take off that whole day of Remicade infusion, and then usually 2 days following didn't feel great. And I was sitting there on my graduation day, and I remember sitting there in my last Remicade infusion thinking, there's no way in fucking hell I'm going to be able to take off this amount of time as an investment banker, first-year analyst. So I made the decision to go off of Remicade, and I started Humira, which was a drug that I had actually failed previously in college. I had done the injections for 6 months, and it did not fucking give me relief, which is why I went on Remicade. But I was naive, I was excited, and I also felt like I could make those decisions and that they would pan out for me. And I'm kind of glad I gave it a try, because then I realized, after a massive fucking flare-up and severe body deterioration, that was not a good decision. So I learned the hard way that if you say no to medications because you want a certain lifestyle, there can be repercussions. And that doesn't mean that you are always going to have repercussions if you say no to a medication, but it is a real possibility. And that's why it's just important, point blank, PSA, have these conversations openly with your doctor and provider. Let them know about the things that scare you or worry you. Let them know about what your life goals are, what your dream lifestyle would look like. Let them know what therapeutic goal you're trying to get to so that you can unlock that life. Because the more information they have about what you envision life looking like, the better off you'll be, because they can help you get there. Maybe not just with medications, hopefully not just with medications, hopefully with some lifestyle shifts too. Physical therapy, diet, functional medicine, Eastern medicine, you name it. They might have some directions, or you find a podcast like this where you hear about all those different things and you start plugging them into your own protocols and realize, oh, I can feel a little bit better. Maybe I can dose down on a certain medication. Maybe I don't need to take as aggressive of an autoimmune medication because I'm doing all these other healing modalities that are getting me from point A to point B, and all of your doctors are on board. When I look back to 2023, the one time I've been in remission in my entire life, off of autoimmune meds, chemotherapies, immunotherapies, only thing I was taking was, well, I guess not totally off. I was taking Plaquenil still, but a very, very low dose. I was taking anxiety medication still, and that was it. And I remember just feeling shocked that that was a possibility in my life. I had been on Cytoxin a year prior. How did I go from that to free of medications? It was because I was so open with my doctors, let them know my goals, let them all talk to each other, pulled in my functional and Eastern medicine provider, my physical therapist, and made them all talk to my quarterback doctor to make sure that we were doing things appropriately so that I could stay in that remission-like state. And boy, do I think I would have stayed in that remission-like state if it hadn't been for that fucking botched spinal surgery. But that is a story for another day. Well, this was a rather long listicle of an episode, but I'm hoping that everybody walks away feeling empowered to say no or not right now in any situation or setting regarding your health, because at the end of the day, it's your body and it's your life. And I want anybody that's a part of this Calling in Sick community to feel educated enough and empowered to make decisions with a medical team to have the life that you want and deserve to have. And that's something I'm still working at today. I don't know how to say no perfectly. I'm still a little people-pleasing gal, but I am actively challenging myself and pushing myself to do better at finding the confidence to say no. Which brings me to my one brain cell pick of the week, Wednesday on Netflix, because Wednesday Addams serves no, fuck no, not right fucking now energy left and right. And if we can learn anything from that girl in that show, is that it's your life, it's your body, and you can do whatever the fuck you want to do within reason. Asterisk, within reason. So if you need some confidence boosting to feel that, I can do anything, go check out the show. It's on Netflix. It's awesome. It's empowering. It makes you feel like $1,000,000. It's not too spooky, but a little spooky. Cooper and I were thinking about saving it for Halloween because we like watching comical horror around the fall season, or light scary around the fall season, and that's how we started watching Wednesday, was last year. But we just couldn't wait. It dropped on Netflix, and we're like, we have to start watching it right now. And we did, and it's been wonderful. So, happy watching, my friends. Happy confidence to say no or not right fucking now, and let's get after it. You have the power and the free will and the autonomy to manage your chronic illness in a way that is feeling good to you. And on that note, I love you guys, and I'll see you next week. And that's a wrap. Thank you so much for joining me for another week of Calling in Sick. As a reminder, I would love for y'all to like, follow, subscribe, save, share with a friend, do all of the things. It truly helps grow this community, and it helps these episodes reach the people that need them the most, whether that's for an educational piece, to have a little laugh, or to not feel so alone. As a reminder, Calling in Sick sits on YouTube, Apple, and Spotify, and anywhere else where you can find your listens. From the bottom of my heart, I absolutely love you guys. Thank you so much for calling in sick with me every Monday. It's been an honor and a pleasure so far, and I can't wait to continue building this community with y'all. Love you.